Hi, my name is Dr. Corey King with Pure Health. I wanted to explain a little bit about prolotherapy with you today. Prolotherapy is this overarching term that means proliferation of joints. So proliferation of tendons and ligaments to actually heal and be stronger. There's 3 different types of prolotherapy that we use, and the only difference is actually the medium or what we're actually injecting. So the first type is called dextrose prolotherapy. Dextrose prolotherapy is just using a sugar water mixed with procaine and a little bit of B vitamins to actually stimulate the body's healing response. The next one is PRP prolotherapy, and this is where we actually take your blood, we mix it, and we get the platelets, and then we do injections of that. So that's a little bit of a higher grade compared to dextrose prolotherapy because the PRP actually has growth factors. So instead of recruiting the body's growth factors, which is what dextrose prolotherapy does, PRP actually has those growth factors in it. The last one we do is biological, or some people would call it stem cell prolotherapy. I don't use that often because I have such good results with PRP and ozone, but that would be the last type of prolotherapy that we could utilize. A lot of my patients come to me with joint pain. It could be joint pain that's osteoarthritis or rheumatoid arthritis, but joint pain really affects a lot of people, and we have a regenerative medicine technique that we're able to use, which is really amazing because what we do is we take blood from your own body, we mix it, and we get PRP, which is platelet-rich plasma, and then we utilize that to actually stimulate your own body's healing response. This is amazing because it's non-toxic, it's not a drug, it's just really utilizing your own body. I see a lot of athletes in my clinic. A lot of them have had PRP before. What separates me from other doctors is that I use ozone therapy, which allows athletes to get to training quicker than just PRP by itself. The thinking behind using ozone is that it actually creates oxygen in the space, in the tissue, to help it heal faster. So tendons and ligaments don't have a lot of blood flow. That's why they don't heal that well. So incorporating ozone into the joints is gonna allow that flow, is gonna allow that oxygen to get there so that the healing is much quicker. Most patients that do PRP without ozone will have to take 2 to 3 weeks off of training because the PRP actually causes inflammation, which is gonna stop them from being able to train. The integration of using ozone is gonna allow patients to get back to training quicker. Usually 2 or 3 days is all you have to take off before you get back to training. The way I was trained is called comprehensive prolotherapy or comprehensive PRP prolotherapy. This entails multiple injections into and around the joint to actually heal the whole joint. So instead of using 1 or 2 injections into the joint capsule or where you're possibly having a tear, I treat the whole joint because it might not just be 1 or 2 spots that are causing you issues and causing you pain. It could be multiple areas, and the goal of prolotherapy is to heal the whole joint, right? Heal all the tendons and ligaments to help with sustaining and regenerating your tissue and cartilage. I've had great success with treating patients. Most of the time, patients need 2 to 3 treatments. We space them about a month apart. After the first treatment, most patients get 20 to 30% better or improvement in their joint, and we'd see them again in a month and possibly for a 3rd treatment. But most patients are pretty much pain-free after 3 treatments. PRP treatments can benefit all ages. I've seen patients as young as 15 to patients as old as 85. Pretty much anyone that has pain is a candidate for getting PRP treatments. So when you come in for your PRP treatment, the first thing that we do is we extract your blood, just a regular blood draw. We take about 4 to 6 tubes. We'll put it in a centrifuge, we'll spin it, and then we have these special tubes that actually have a gel separator. And these tubes will separate your red blood cells, your white blood cells, and then your plasma. From the plasma, we actually take the PRP, which stands for platelet-rich plasma, and that's the liquid gold that we use to actually inject. After that, I will mark up places and areas that are causing you pain, and then those are where we're going to be doing the injections. It takes about an hour to do the whole procedure, and you'll be able to get back to your normal activities in 2 to 3 days. Things that you need to do before you come in is drink a lot of water. I don't want you to be taking any anti-inflammatories, because if you're taking an anti-inflammatory, that's going to actually decrease the efficacy of the treatments. This is because when we do the injections with PRP, it's actually creating an inflammatory response. So it's like we're creating micro injuries into the areas that we're doing the injections. This is going to actually help your tissue, help your tendons and ligaments regenerate, regrow, and become stronger. So stopping all Advil, aspirin, anything that's really anti-inflammatory, you can still take Tylenol. A lot of patients ask me when they should come in for PRP, and my answer always is, if you're having pain, then PRP treatments can help. If you're having knee pain, shoulder pain, low back pain, if it's out of a scale from 1 to 10, if the pain is 7 and under, PRP therapy may be able to help. If you're experiencing a recent injury or even a chronic pain issue, please reach out to our office and I'd be happy to help you.